Hello and welcome to whoever happened to stumble upon this video or come back to my channel. Hi, my name is Dana and I'm very happy to have you here today. So today I'm getting back to my roots. One of my original videos was all about nursing school, and today I'm going to be giving you guys 5 tips for starting out your nursing school clinicals, because I remember I was absolutely terrified to start clinical that morning. I remember looking in my mirror and being like, I don't know if I can do this. Absolutely freaking out. And you don't have to be. I'm just gonna give you guys some tips that really helped me just relax and feel myself in clinical and kind of make my days run smoother. So I'm gonna be giving you guys 5 tips. And if you have any other nursing requests from me, I'm going into my senior year of nursing school. Absolutely cannot believe that that's happening. Mind blown. And I have spent this whole summer working as a CNA in a hospital, so I've gotten a lot of patient experience. I also have another video on 5 tips from a nursing tutor. So if you have any nursing questions that I have yet to answer that you want me to answer, let me know and I will make a video about it. I also am planning on making a video about essentials for clinical that I recommend that you pick up. So before I start with the tips, just a quick little disclaimer, like, you're going to be nervous. That is completely normal to be stressed. Don't stress yourself out too much. What's the worst that can happen? It's gonna be fine. But it's normal. You don't have patient experience yet. It can be stressful. Even just knocking on the door and walking in and saying, hi, I'm Dana, I'm going to be your student nurse today, used to be terrifying. And that's normal, and everyone gets stressed, and it's okay. It's all new. You're going to learn. You're going to gain so much experience and so much knowledge. So just trust the process and know that you will be okay. Getting into my actual tips, now I gave you my pep talk. First one, stick to your morning routine. I know clinicals are so early and you don't want to wake up that early. It kind of sucks, but it's okay. It's just part of the nursing major life. It's like a rite of passage, having to wake up at 5 a.m. That's fine. And I don't know about you, but I have like a very strict morning routine. I like to wake up an hour before I have to leave. I like to drink my coffee, eat breakfast, become awake, and feel like I'm a human. So if you have a normal routine that you go through, I recommend you follow that even on clinical days. Specifically, eat breakfast. Clinical days are really long, especially, I know my school, we do 8-hour clinicals. Some schools do 12. Eat breakfast. Some clinicals, they'll give you a lunch break. Some you eat at post-conference. So I've had ones where you get there at 6:45 and you don't eat until 3 o'clock. So eat breakfast, bring a granola bar. So if you have a quick break, you can go and eat. That's another thing. It's like a little bonus tip. When you're at clinicals, drink water. I know some people, because you always hear, oh, nurses never have time to go to the bathroom, they never have time to eat. You're not a nurse yet. You only most likely have one patient. It's totally fine, and very much encouraged that you stop and drink water and have a little snack, maybe keep granola bars or like pretzels or something in your bag. So if you don't have something to do and you have a little bit of downtime, you know, you're not gonna be in your patient's room bothering them the entire day, go and drink some water. I've had people in clinical who are like, oh my God, I feel terrible. Like, I haven't drank anything all day. I'm like, why? Why are you doing this to yourself? Go and drink some water. It will make your day so much better. No one wants you passing out in the middle of clinical. I actually have done that. Not from not drinking. I passed out in a C-section, but that's a story for another time. So, tip number 2, practice. Specifically on people, and more specifically on people that you aren't super comfortable with. So this is gonna help you get used to being uncomfortable and performing your skills, because you know, you practice in your skill labs, on your mannequins, you practice on your friends. I recommend practicing on people who you aren't super close with. So this could be like a little bit awkward, but that's part of it. You wanna get out of your comfort zone. A lot of times people aren't gonna say no. You know, they don't mind, it's fine. My sophomore fall, before I became an RA, I lived in a townhouse with some of my friends and then some people that we didn't know. And I did head-to-toe assessments on every single person in that house, even my RA. I wanted to get experience, and I wanted to get experience being uncomfortable, because that's really gonna help you get used to your skills. Because if you just do it on your friends and you're joking around, you do it on your mom or your siblings or just your mannequins, you don't get used to that kind of awkwardness of being like, okay, I actually have to touch this person that I don't know. So that is really helpful, to do it on people that you aren't comfortable with. Number 3, take every single opportunity presented to you. It can be really nerve-wracking at clinical because maybe your nurse will be like, oh, I have to change this dressing, like, do you want to do it? And you're gonna be thinking, I have never done that in my entire life. Like, I have no idea what that is. I've never seen this. I don't know any of the supplies. But go for it. Say, I would love to help. I've never done this before, but I would really like to gain that experience. Or, yes, if you could walk me through it. They're usually, if they're asking you if you want to try, they're willing to help you. So don't be nervous. Don't shy away from it just because you've never done it before. Because if you say, oh, I've never done it before, I'm not going to do it, then you're never going to do it. And you will have always never done it before. My first ever day of clinical, I remember my patient had a PICC line and they needed a sterile dressing change, and my professor was like, we're gonna do this. I was like, what? I was like, you mean I have to change dressing, put on sterile gloves, maintain sterile technique, do all these things I've never done before all at the same time on a real person? And she was like, mm-hmm. And she's like, I'll walk you through it. And I was sweating. I was so nervous, and you had to wear a mask. This was before everyone wore a mask because they didn't want you breathing on this patient's line. And the patient had to wear a mask, and I was like shaking, opening my tegaderm. It really wasn't that stressful, but go for it. And even if your nurse has other patients and they say, oh, I have to go do XYZ for this patient, like, can you help me? Say yes. As long as your professor is fine with it, go for it. Any opportunity you can get is a good opportunity. And some nurses and CNAs and techs will be really nice and will say, oh, I have to go do X on this patient. Like, do you want to watch? Because they know you're trying to gain experience. If you're not busy, go for it. If your patient's going down for a test, ask your professor if you can go too. Gain really cool experience, get to see lots of things, and sometimes people will talk to you. I had a patient, she was going down for some test in nuclear medicine for her kidneys, and I remember I was sitting there next to this doctor and he explained the entire thing to me, and it was really interesting. So if you're open to it, you're nice, you ask nicely, people love to help you and love to teach. Not everyone. Sometimes you get a meanie butt who is like, okay, if you don't know how to do it, I'd rather just do it myself. But that's fine. Don't get discouraged. It's more has to do with them than it has to do with you. Number 4 kind of goes off of that, and this is ask questions and ask for help. Because how are you going to learn if you don't ask? If you're confused, sometimes professors, they can be really intimidating, but if you don't understand something, one, for a patient safety reason, like if there's a med you're giving, or even just like a task you have to do and you really don't know how to do it, but you're scared to ask because you don't want your professor to get upset, it's obviously safer to ask and get clarification before you do something, but also just for your own learning. Like, a lot of times I know we'll have to read doctor's notes and I'm reading them and I'm like, I have absolutely no idea what this means. So I'll ask somebody, oh, I've kind of gathered this from the note so far, like, can you help fill in the blanks for me, or can you explain what this procedure means? I'm not really sure. And a lot of times they might tell you to look it up yourself, but even so, you're still gaining that experience, or they'll show you where to look for it, and it's good to kind of ask questions. And also, a lot of times you can be asking good questions. Like, I know you might look at a patient's med list and be like, I don't think these 2 meds make sense together, but what do I know? But really, like, you could be piecing something together that people haven't noticed yet. And even just posing these questions to your professor, you could be learning something new or pointing out something important. Same thing with asking for help. I know a lot of times you want to look like you know what you're doing. Especially when it comes to like moving patients, I always ask for help. I know sometimes at work, this is outside of clinical, but kind of same, I'll be like, oh, I need help transferring this patient, and I've had other techs say to me like, I transferred them by myself, and I'm like, okay, but I don't feel comfortable, and you'd rather have that extra hand and be safe. Or even just like a lot of times in clinical, I know me and my friends would always give bed baths together just because you're nervous to be by yourself with the patient, and that's completely fine. And really, it benefits everybody, because instead of just giving 1 bed bath for 1 patient, you gave 2 with your friend, and you both learned more and met more patients and saw different people with different conditions. So asking for help and asking questions is good. Sometimes professors, like I said, sometimes you have mean nurses, sometimes you have mean professors, and it kind of sucks that some people don't want you to ask questions. There are things that you're expected to know, but you're trying to learn, and it's good to ask questions when you have them. And my last tip, which is a really good thing to keep in mind, is you want to act like a person. And you might be wondering what I'm saying, but a lot of times when you're at clinical, you have a checklist of things you have to do. You're like, okay, I have to get X assessment done, and you just go through step boom, 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 and then go into like autopilot. You're like, I need to do X, let's do it. And you kind of forget that like, I'm a person, this patient's a person, and you don't interact on like a person-to-person level. You just kind of function on like I have a task to complete level. Like, I need to do X, Y, Z, and that's it. And sometimes you don't stop and kind of think deeper about what's happening or really take in kind of what you're learning. You just kind of go through the steps and just to do them, not to learn from them and not to connect with your patient. And especially when you're asking them things like, are you in any pain? Or like if you have to provide patient teaching, don't just kind of autopilot through it. You want to really like connect with this person and try and understand where they're at and meet them there and see if you can help them. Go outside of your comfort zone really when it comes to these things. And sometimes you want to go like, I have to do this, and if you get interrupted, you're going to forget where you're at. But it's okay to act like a person, stumble up. And I know sometimes I would go in and I would like try to be putting some IV tubing together and I would miss, and I'd be like, oh my god, they probably think I'm so dumb, like they think I have no idea what I'm doing. That was my biggest worry, that like the patient would feel like you have no idea what you're doing. But really, they're fine. They understand, especially going to take vitals and you've never used this machine before. Like, it's okay, you're a person. People understand. I would always make a joke or make small talk and just kind of relate to your patient. It also makes your day better, because a lot of times people think patients don't want a student. That is absolutely not true. Patients love having a student, especially older people. They love having someone who has their undivided attention and will pay attention to them all day and listen to them talk. They absolutely love it. So when you can relate to your patient, and even sometimes like I've learned a lot. I did the training for a suicide hotline, and also like they have a second hotline called their contact line, where it's just to talk to someone if you're having a bad day. And I've learned so much through that about talking to others and really listening to people, that I've applied in clinical, where sometimes you see a patient and they just got news or something, and you can just sit down and be like, oh, like I know you just met with this person, like how do you feel about what's going on, and really talking to them. That might not be what your assignment was that day, to sit and talk, but if it's something that you can do that's beneficial to the patient, I think I'll go for it. Those were my tips. I hope that was helpful. I feel like I kind of just like babbled, but I hope you got something out of that, and good luck to you guys on your clinicals. Tell me what rotation you're doing this semester. So exciting. I miss my peds rotation. Every time I go to peds at work, I'm like, yay. I want to be a peds nurse, in case I don't think I've ever said that before on my channel. I want to be a pediatric nurse. Like it if you liked it. Like I said, if you have any questions or other video topics you want me to talk about regarding nursing school, I have a couple nursing school videos planned upcoming once school's starting, so stay tuned for those, and let me know if you want any specific ones down below. Subscribe if you have not already so you do not miss my content. I post new videos every Sunday and Wednesday, and yeah, thank you for hanging out with me today, and I hope you have a great rest of your day.